Good evening, dear viewers, and good evening, Dr. Fatima.
Good evening, Abdullah, and welcome, dear viewers, to another episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier lives.
Digestive health plays a vital role in our overall well-being, yet some conditions remain misunderstood, misdiagnosed, or silently ignored.
Definitely, Abdullah. Inflammatory bowel diseases, especially Crohn's disease, ulcerative colitis, are chronic conditions that can affect significantly a person's daily life. It could cause pain, fatigue, and ongoing digestive challenges.
And that also may impact both the physical and emotional well-being. Many people may confuse these conditions with simple stomach issues, delaying proper diagnosis and treatment.
So, to better help you understand these conditions, the causes, the symptoms, and modern treating approaches, we are pleased to welcome Dr. Khaled Alazemi, gastroenterology and IBD specialist.
Dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatima Al-Ansari, and you're watching your weekly Medical Talk.
Hello, dear viewers, and welcome to another episode of Medical Talk. Today, we have with us Dr. Khaled Alazemi, gastroenterologist and IBD specialist. Thank you so much for taking your time and being with us here today, Dr. Khaled.
Thank you. It's my pleasure.
Welcome, Dr. Khaled, to our show.
Thank you.
Dr. Khaled, today we have a special topic, which is Crohn's disease and ulcerative colitis. Can you tell us exactly what are those diseases and how they relate to the IBD, which is the inflammatory bowel disease?
So both ulcerative colitis and Crohn's disease are under the umbrella of inflammatory bowel disease. These are inflammatory diseases of the gut, basically affecting the digestive system. Each one of them has its own characteristics. They are both considered an autoimmune disease, which is basically a disease where your immune cells attacks its own body cells. For Crohn's disease, this is a disease that can affect basically any part of your digestive system, starting from your mouth up to your colon. For ulcerative colitis, colitis is basically mean the colon or inflammation of the colon. So it's basically confined to the colon, starting from at the end of the colon, like from the rectum up to the whole colon. They are common here. We see many patients, and they are both managed differently.
Thank you for that, Dr. Khaled. So, Dr. Khaled, what causes these conditions? Are they genetic, immune-related, or they're mainly lifestyle habits that cause these things?
Yes, so it is actually a conciliation of things happening together. So basically it's an interaction and an interplay between genetics, environment, and basically like risk factors that make people susceptible to this, to both of the Crohn's and ulcerative colitis. In a person who has a specific genetic predisposition, like in Crohn's disease, there are almost around 240 alleles, which are basically genes that were found to be related. And there are we can track up to specific genes that can be linked to these to Crohn's and ulcerative colitis. As Crohn's is basically a disease where it affects any part of the gut, and basically ulcerative colitis, as we said, it's only affecting the colon, so they have different loci. And there are other environmental factors that can really happen with that. And also some risk factors, like such as
Lifestyle factors.
lifestyle factors, yeah. One of the things could be like simple as smoking.
Mm.
So, Dr. Khaled, you're talking about the different risk factors. What are the common symptoms of these diseases, and when should a person seek medical advice?
So in terms of symptoms, so let's take it by each disease entity by itself. So for Crohn's disease, the most common symptom is abdominal pain. The pain is usually in the at the end of the abdomen, like in the lower abdomen. It's associated with fatigue, and it can be with or without diarrhea, basically. The diarrhea can have blood or no blood in it. That's the main symptoms of Crohn's disease. In terms of ulcerative colitis, so as it's affected only the colon, it's more of a diarrhea, most of the time bloody. And there is also what we call urgency, where basically the patient would just have frequent visit to the bathroom, even at night. It might wake him up from bed.
So at these times when a person goes a lot to the bathroom and when he notices blood in their stool,
Yeah.
that's when they should seek medical advice.
That's when that's when they should seek it. But keep in mind the gastroenteritis, which is basically infection of the digestive system, is a common thing, especially in this month, like around the summertime. So they should seek if they see blood in their stool, that's for sure. But diarrhea, if it's a diarrhea that has been, let's say, less than 4 or 5 a day and has been consistent for more than a month, then they should definitely seek medical advice.
Now, Dr. Khaled, many people, they do ignore any digestive problems or symptoms that they may have. Can you please tell us and share what are the warning signs that people should look after, or these symptoms?
So, mainly it's the persistent pain that's there for at least 4 weeks or 6 weeks. Weight loss is an important thing to watch. Like if you're not trying to lose weight and you start losing weight with the pain, that's a concerning sign. If you start to wake up at night because of your symptoms, let's say for the pain, because of the pain, because of the bowel movement, that's something we need to be worry about it. Excessive fatigue, that's unexplained by like an acute illness or like you don't have a fever. These are the ones I would definitely be watching for.
Yes, yes.
Well, Dr. Khaled, thank you so much so far for these valuable information. I'm sure our viewers are listening and keeping in mind these symptoms and the different, but we still have more questions for you, Dr. Khaled, after this break. Welcome back, dear viewers. We still have Dr. Khaled Alazemi with us talking about the different bowel movement diseases like Crohn's and ulcerative colitis. Dr. Khaled, how are these diseases diagnosed, and what test or investigations one person can do?
So there are many modalities to diagnose these diseases. We start first with blood work. And with blood work, we will get some basic tests like a CBC to check if the disease itself, the bleeding itself, is it significant, causing like iron deficiency anemia. Also checking your kidney function, your liver function, as these diseases sometimes can also be associated with some liver disease. After that, we need to rule out infection, and we do that by multiple tests like blood cultures and stool testing. We also look for inflammatory markers that are either in your blood or in your stool, and this will help us to give us an idea to guide us to the next steps. Basically, after doing this investigation of blood work, we go to the next one. Sometimes we'd have some imaging. This could be from an MRI or a CT scan, or sometimes just a simple X-ray to see how bad or how severe is your disease. To further diagnose these diseases, we do a colonoscopy or an endoscopy. So basically, it's a camera test where you will be sedated. We'll go in and we'll have a look inside of your intestine, and just to make sure how far is your colon affected, and if your small bowel are affected. And we can take biopsies. So to sum it up, the diagnosis basically it's composed of 4 components: symptoms, blood work, investigation, at the end is the biopsy, which we take. That's all. Combining all these 4 together, we can make the certain diagnosis of inflammatory bowel disease, either Crohn's disease or ulcerative colitis.
Dr. Khaled, at the beginning, everything is clear so far, but at the beginning you said something about a test called CBC, I think?
Yeah, a CBC.
Can you
tell
us?
So CBC is a complete blood count. So we do a CBC. A CBC is a complete blood count. It's a test that we can check from it if you have like low blood count or not, if you have a sign of infection, like a high white count, which is basically white blood cells, which are basically your immune system cells.
Yes. Dr. Khaled, you mentioned earlier endoscopy. How important is the role of endoscopy in monitoring these conditions? Do you do follow-up also at, after patients are treated with the endoscopy, or it's just for diagnosing?
Yeah, so there are multiple ways to follow up the patient after the diagnosis. As I said in the beginning, we have inflammatory markers and a stool inflammation marker. The stool one is called fecal calprotectin. It's basically a substance that we measure in a stool and tell us how bad is your inflammation. We can monitor through this test. We can monitor your response to treatment and if your disease is worsening. And it's good also to predict if you will develop any flare in the future because of your disease. And colonoscopy and endoscopy in general are important part. However, now we do other tests to check for them, like intestinal ultrasound. So I have been doing this for the past year. So it's basically an ultrasound. It's like a regular ultrasound, and we just monitor your response. We can monitor your response to treatment, and it is as equivalent to MRI and CT, and it's done like on a everyday clinic. It's like a 10-minute test.
Oh, wow.
Yeah.
That's good.
Dr. Khaled, we're talking about the different diagnoses of these diseases. What available treatment options are available today, either for the Crohn's or for the ulcerative colitis?
Yeah, so for the treatment, we usually treat them by their severity. It can be as simple as just give you some medication for a few weeks and then watch how you respond to that. Or it can be up to having like an IV injection every couple of months to treat your disease. So for both mild Crohn's and ulcerative colitis, we do give people tablets. There are multiple different types of tablets. We have what we call anti-inflammatory one, like steroids, which we just give it for a short time, especially like if you have very mild Crohn's disease, we can give you like a short course of that. Other medication are called immunomodulators, so they modify your immune system, and it's one we usually use for ulcerative colitis is called 5-ASA, which is basically a tablet where you take it daily. You can take it by mouth. We can give it to you topical or through like rectal enema. That can help with it. If things get more advanced, if you have moderate, and by moderate I mean depending on your test, and that's why we do a regular blood work every few months. We do endoscopies if needed. We do ultrasound and imaging. If we feel that you are in the moderate to severe category, then we can discuss a treatment with a different category of medication. These are medication that basically help to block certain pathway of inflammation. And the nice thing about them, we have many forms of those. We have like tablets, but these are mainly for ulcerative colitis.
Okay.
We have weekly injection, bi-weekly injection, and we have like monthly or every 2-month injections.
Does it depend on the patient's
Depends
condition?
on the patient, depends on the disease distribution, depends on how severe it is, and depends if the patient had any other associated illnesses. I just want to mention that with inflammatory bowel disease, it's an autoimmune disease. So autoimmune disease come together in clusters, and multiple things are associated with that. We call it extraintestinal manifestation of inflammatory bowel disease. There can be diseases that affect your skin, like psoriasis, can be associated with that. Inflammation of the joints. And also sometimes it can affect the eyes, causing something called uveitis.
Oh, wow.
Yeah.
Okay.
So all of these taken into consideration can tell us what would be your best treatment. And actually here in Java, we do like an MDT, multidisciplinary team round, which basically we sit together like gastroenterologist, surgeon, radiologist, pathologist, and also sometimes rheumatologist and dermatologist. to discuss these cases and see what would be a better option for the patient in terms of what to choose. However, sometimes medical therapy does fail. Medical therapy do fail sometimes. So we usually then might need to go to surgery. As I want to mention about Crohn's disease specifically, with the severe inflammation, with the severe inflammation, the nature of its inflammation, because the main difference between Crohn's and ulcerative colitis is the thickness of inflammation. Crohn's disease affects all the layers, like the wall of the intestine, while ulcerative colitis, just the outside layer. So with Crohn's disease, usually we would get what we call a stricture. A stricture is a narrowing. So it could be a tight area, any part of your digestive system. Sometimes we can treat that with medication if it's from inflammation. However, if it is what we call fibrotic, meaning that it's overwhelmed, it's done, like it's totally disease and it's stiff, we do sometimes have the option of dilating it through endoscopy. We go with the camera, we go to, if we can reach it by the endoscopy, and then we just dilate it with a balloon sometimes, with a balloon. If we can do that, then we would go to the second modality, which is surgery. Surgery applications are many, like there are certain surgeries for Crohn's disease and others for ulcerative colitis. Crohn's disease at some times can actually cause what we call the fistula. A fistula is just basically a communication between two hollow organs.
Okay.
And it can be between the intestine, and sometimes it can be between the colon and the outside, like the skin, which is considered an organ, so different surfaces.
Yes.
So there are certain surgery that we can help to treat that in Crohn's disease. Unfortunately, there is some percentage of patients with ulcerative colitis who do present with what we call acute severe ulcerative colitis. It is basically very bad inflammation that the patient would have like more than 10 bowel movement. They would have high heart rate, fever, abdominal pain. Sometimes, so normally we get them into the hospital. We try to treat them with IV steroids. If that didn't work, we use a biologic medication. However, there's still a percentage of those patients who would fail all of these measures. So we would go to like basically a surgery at the end. So to remove the whole inflamed part.
Wow, thank you, doctor, for that detailed answer. Appreciate it. So it seems like long-term management is highly important in your field.
Yeah. So that's the cornerstone of inflammatory bowel disease, and that's one of the reasons I wanted to be like an IBD specialist. Is that these diseases need like a long-term follow-up and also a multidisciplinary follow-up. Like we don't only follow the patient up in terms of their disease, we follow but also with other associated diseases.
Yes.
And it actually has a huge effect on their general well-being. So that's something we are trying to improve, trying to answer the patient question. Sometimes after disease, people would be in what we call, they would have anxiety. So we try to calm them down and explaining to them the option we have. And thankfully, over the past 10 years, we do have more and more medication. And in the future, like we are having hopefully 3 or 4 more medication the next 5 years.
Oh, wow.
Yeah.
Fabulous. Thank you, Dr. Khaled. Dear viewers, we're going to take a short break and we'll be back.
Welcome back, dear viewers, to Medical Talk. We're still with Dr. Khaled Alazemi talking about the different IBD diseases. Doctor, what happens if these diseases are left untreated?
So it's like any other chronic diseases. These diseases, they go through their course. So it's basically wear and tear at the end. You could get through a few of the flare of the disease where you get inflamed, but you can't really prevent the complication. And one of the worrisome things that we really want to stop is that we don't want with the chronic untreated inflammation, some people can develop what we call malignant cells or a malignant focus. And these could be simply treated with just removing them with endoscopy. And they can even, we could try to prevent them. And people with inflammatory bowel disease are actually having 1.7 times the risk of cancer than the general population of colon cancer. That's something we need to bear in mind.
Yes.
Also, when we treat them, we're actually trying to prevent complication. The simplest would be bowel. Sometimes the bowel could be obstructed. With Crohn's disease, as we said, it can cause stricturing or narrowing of the digestive system. With ulcerative colitis, which is basically the inflammation of the whole of the colon, sometimes with the severe inflammation, people could end up with incontinence, or they could like have lost their control of the stool. So that's why we are trying to help prevent these disease, and that's what I really try to explain to the patient when they come to my clinic, that my goal is actually to prevent this from happening, and at least do my best to, if something started, to stop it from happening.
Dr. Khaled, what are the most complications patients suffer from with these certain diseases?
So,
I mean, obviously, if left untreated.
left untreated is basically what you're worried about is cancerous.
Yes,
And
as
also,
you mentioned earlier,
and
yes.
with Crohn's disease is what we call a perianal disease, which could be really devastating to the patient and affect their quality of life, where they have prolonged drainage of these fistula. As we said, the fistula is communication between two hollow organs.
Okay.
So if there's a communication between your colon or your intestine with your skin, that could lead to infection, that could lead to what we call malnutrition, and this could be a chronic thing, and sometimes surgery would be very difficult, especially if if there's an extensive disease to deal with.
Dr. Khaled, what about natural remedies? Like maybe some people take natural remedies to treat these diseases. Are they effective?
Yeah, so that's really a great question. I do encounter this question a lot in my clinic. And so the issue is that there are there is evidence. Let's take an example like honey. A lot of people would come to you and said, "Hey, doctor, I found this Crohn's disease honey, and
Maybe they can find it online or see some
anywhere."
advertisement for it.
Well, if we go to the studies regarding that, there are preclinical studies, which are basically studies on the animals. Honey by itself is a great, it's a great food, and it has a lot of anti-inflammatory substance in it, and it does work with animal studies. However, we could not replicate it in human. We don't know what kind of honey. We don't know what would be the dose, the frequency,
Yes.
for how long. Do we use it to prevent flare? Do we use it to treat an acute flare, or do we use it to even prevent it? Like, that's something people think of.
Yes.
So results in animal may not equal same results.
We do not replicate it in humans. So
Definitely.
there are other things. Like there is also about what we call the good bacteria. There is some evidence in one of the inflammatory diseases, like it's called bronchitis, which is something that happens sometimes after ulcerative colitis surgery. There's some evidence of that, a specific kind of them, but at the end, the evidence is still not like, the scientific studies are not like well established in that area.
Yes. What about supplements, doctor?
So it's follow the same idea.
Yes.
Like even though they, like the omega-3 and they are like, they could be helpful in somewhat, but there's no evidence of them that they are truly working in inflammatory bowel disease.
Okay.
So the best course of action is actually coming to a hospital.
Come to a hospital,
doing
see a
Definitely.
doctor. Like make sure you get the diagnosed early and treated early. Like now we are promoting the early detection and diagnosis and treatment of inflammatory bowel disease. At these two, if we tackle them, we could really prevent the complication, which have a huge impact on the quality of life of the
Definitely.
patient.
Well, Dr. Khaled, thank you so much for coming here and giving us these valuable information in detail. Thank you so much for
Thank
being
you.
with us here today.
Thank you, Dr. Khaled. It was a pleasure having you.
It was a pleasure to meet you.
This brings us to the end of this interview, but we still have more segments coming up on Medical Talk after this break.